then we'll get started. Good morning, everyone. We're so glad to have you here this morning. I'm Melissa Haley, the Chamber's Executive Director, and we also have our board chair, Amanda Porch, on the line this morning. So we thank her for being here. Good morning, Amanda.
Good morning.
And we have a very important topic to discuss this morning. COVID has, of course, changed all of our lives in the past year, and we'll have some lasting or some definitely effects right now and potentially some lasting effects on our businesses. And so we wanted to give some space to talk about that. And so we've asked two of our wonderful legal professionals that are part of the Chamber to help us interpret and understand what those mean and how we need to react to them. So I want to introduce Mike Gladstone and Chris Johnson, who are both joining us this morning. Good morning, gentlemen.
Morning.
Hello, everybody.
Hello.
Great to have you all. I know that we sent everybody a couple documents in preparation for today. One is a summary that Chris and Mike have prepared to help you sift through the large document to understand the most important pieces. And then we also supplied you with the full-size document that has all the specifics in it so you can refer back and forth as needed. And so this morning I'm going to share my screen and we will begin with our first slide, which is introducing our wonderful panel. So Mike Gladstone has been a part of the Chamber for many years. He has been practicing law for over 38 years and has so much great experience to bring. And he and his partners at McCandless Holton do regularly advise clients on issues like this and others that are related to employment law. So Mike, thank you so much for being here. A long time, or have you always lived in Hanover? I know longtime Hanover resident.
Well, we moved in I guess around 90 or 91. So we've been there a while. Our children are Hanoverians. My wife and I are come-eres.
Well, I consider you a lifetime resident here because as long as I've known you, and everybody knows you, Mike. So. And
our children all have PhDs, Patrick Henry diplomas.
Perfect. And our second guest on our panel this morning is Chris Johnson, and Chris's office is right out in Rockville, Johnson & Johnson, and he has been practicing for over 10 years. That's right, Chris?
Yeah, right. Well, right at about 10 years. Yep, getting close to it.
Working with a large variety of clients and including things related to today's topic. So thank you so much, Chris, for being here.
Thank you.
And I'm going to, I didn't know I'd lost my slideshow there. I'm going to switch it over to the experts at this point, and I believe Mike is going to kick us off.
Let's get underway. I guess the several things just as a mechanical approach here. The program is going to be a bit of a back and forth between Chris and I because we've taken the topics and the summary that you were supplied and kind of split them up. So we'll take turns talking about them so that you don't get too much of any one presenter for too long a time without a little bit of a break. So the other thing that I would point out is that there's the documents are important in this respect. The summary outline is just that. It's a summary outline of what struck us when we were going through the standard. Sadly, there's a typo or two in there. I hope you'll disregard it. But the big point is that the summary document is the purpose of it is to provide a summarized introduction to the overall standard. For purposes of application, don't think that relying on the standard is satisfactory for complying or bringing your business into compliance with the standard. The summary is an introduction to the standard so far as bringing your business into compliance with the standard itself is the reference. Now, hopefully, our purpose will be successful, and that is to introduce you to the standard so that you're conversant with it and comfortable with it, and can then use that as the item. And in particular, the standard is very helpful because it provides you basically lists and outlines for the written certifications you may need to make, as well as the contents of preparedness plans you may need to make, as well as suggestions, very detailed suggestions for contents of training that the standard requires. So no sense reinventing the wheel. Simply take the time after you've sort of grasped this 58-page item, and follow the thinking that the government has given us on that, so far as organizing your response. You'll note that the standard is broken down into 9 subparts, and we can think about the last number of the Virginia Administrative Code citation to divide them. It starts with subsection 10 and runs on to subsection 90. So at least where I'm concerned, I suppose Chris will do the same, is that if we're referring to a specific subsection, and we're very often going to do that, when we talk about subsection 10, we're talking about the very first one, scope and purpose. When we talk about 90, we're talking about anti-discrimination, and similarly in between with the intervening numbers. The summary does follow the format of the outline. The summary follows the format of the standard. So the presentation today will follow the format of the standard. The experience that all employers have had with the temporary standard that came in the summer, if you were the one at your business that studied that and worked to bring your business into compliance with the temporary standard, you're going to be real familiar with the contents of this permanent standard. There's not a lot of differences between the two. In fact, they can be summarized in a few sentences. The first one is that the reporting obligation to the Department of Health and Department of Labor and Industries changed slightly, but not in an onerous or significant way. You just need to make note of it. The reporting to Department of Labor and Industry has been added for 3 or more positive tests during a 14-day period. The return to work regimen has been changed from essentially a test connected concept to a time passage concept. The face shields are no longer adequate as a protective device. So face shields by themselves are not acceptable. They've got to be combined with some other sort of face covering. Lastly, a couple other items are where some questions had arisen over how many times a work area in a shift oriented workplace, how many times that disinfection had to occur. And that's been clarified at least once per shift, or if multiple shifts, every 12 hours. And the issue of who pays for testing involved in that can be a component of return to work analysis. It's been clarified that while it remains the employer's obligation, that the employee provided health insurance can cover it. So from a 40,000 foot standpoint, if you were really up on top of the temporary standard, you need to go over your infectious disease prevention and response plans. You need to revise your return to work standards. You need to add face coverings to folks who are wearing shields only, and make sure that you comply with, for example, the disinfectant or cleaning requirements if you have shift work. And also just bear in mind that there may be some additional information coming out from the federal government. Remember, this is a Virginia OSHA program. Virginia is an agreement state, so Virginia enforces OSHA in Virginia, not the feds. And so as a result, there may be some federal information coming out, I don't know, in future weeks that will overlay some of what or all of what we have here. But for the time being, that hadn't come yet. The getting to the standard or getting to the, I guess, the bones of our presentation, I'd mention that with respect to subsections 10 through 30, which if you're interested in making a little table of contents, subsections 10 through 30 are at pages 1 through 21 of the standard that we've given you. Important things are that this permanent standard supersedes the temporary standard. This standard became effective on January 27. It provides two deadlines, two hard deadline dates. One of them is for the preparation of infectious disease preparedness and response plans, which have to be done by March 26. The training requirements have the same effective date, and I guess it's encouraging. This permanent standard, nevertheless, does have a provision in it that requires revisiting the necessity of the standard at all once the emergency, the current emergency declared by the governor is terminated. Now, for purposes of the overall discussion, I would highly recommend that you study, I mean, this, except for the different categories, which Chris will talk about in a minute, the risk categories, we're not going to dwell on definition by definition, but it is important to understand and be very comfortable with the definitions that are contained in subpart 30. Now with that, we're going to turn to subpart 40, which is pages 22 through 34 of the standard. And I'm going to start off simply by saying, if you haven't already, you need to start compliance by complying with the requirement that you inventory all the job positions in your business and assess the COVID-19 hazard associated with them for potential exposure. Now, you'll see that that's an essential predicate to classifying them under the risk categories. Chris, you want to talk about the risk categories?
Sure. And I'll just make one quick thing. Is a typo that was my fault on here. Is it says in the outline, it says to see the definitions of the categories on the last page. We actually moved them over to the I guess like the third page, I guess is what it is, but it's pretty clearly defined, so hopefully you can find it all right. So they've classified or set 4 different risk levels, very high, medium, and low. And as Mike and I were talking about the other day, for the most part, the very high, or if you're in those type of businesses, you probably know that and should hopefully have those types of things in place. But those are jobs where, like a very high, for example, are jobs where the exposure is extremely high, basically to people or employees who have known exposure or suspected exposure to the virus. And the very high, I think there's kind of the distinction maybe between very high and high are the very high, are you doing medical procedures or things like that that involve, as we said, that they call aerosol generating procedures, doing intubations, actually taking specimens from people who are suspected of having it. High is more along the lines of, I think what you see is other healthcare providers and doctors' offices where where there may be somebody who's exposed, but it's not necessarily the people that are coming in are not necessarily known or suspected of having it, but you're still in a situation where you're going to end up being around people, more people who are likely very well could have it. So you'll see a lot of examples of that being a lot of most healthcare providers, first responders, medical transports, mortuary services, correctional facilities, things like that. I guess where you run into probably the vast majority of the businesses that we would be talking about today, and I think would be probably in the medium category. And that is basically that you're going to have just more than minimal contact with people, with other employees or the general public. And good examples of that are grocery stores, restaurants, bars, schools, and there's a laundry list of things within the actual. One nice thing is in the, I'll skip back, is in the standard under subsection 30, they list definitions of all these terms, and they actually go through, and we've provided some examples in here, but they do have a little bit longer list within the actual standard itself. Then if you have a more of like, I guess what I would sometimes say is more of an office-like scenario where you have very limited exposure to the public or fairly limited exposure to other employees, then you're in that lower risk category. And a lot of these things, all of the requirements that they're the requirements that apply for all, that Mike we'll be going over in just a second. There's a set series of requirements that apply to everyone. That does apply to the lower level risks occupations. However, there are the very high and medium will have additional requirements that apply to those as well. So if y'all have any specific questions on categorizing them, I think we said if you're kind of on the fence between am I low to medium, err on the side of probably medium. I know sometimes that may be a little, it may be there's certain, I can think of a few different jobs where you might be on the fence a little bit. So anyway, that's just I think that those are those categories. And Mike, I guess I'll turn it, unless you have anything else to add to that, I'll turn it over to you.
No, at this point, what I'd like to do at this point is go through a number of the other requirements that apply to all employers. Bear in mind now we're under subsection 40, which are the requirements for all employers. Now, when I started this, I told you the slight changes between the temporary standard and the permanent standard. So what you'll find is that a whole lot of this stuff you're already familiar with, or whoever your designee to enforce this stuff in your business, they're going to be very familiar with these requirements. But they bear mentioning simply because I give you an intro into the overall standard as we go forward here. So clearly, you have to inform employees about the methods of self-monitoring for disease and encourage them to engage in those methods. The standard makes it very clear, however, that serologic testing, as opposed to the PCR testing, for example, is not a basis for return to work procedures or for allowing employees to join in larger group settings. You are required and presumably have already developed and implemented policies and procedures for reporting, for your employees reporting symptoms, and a system for designating employees that fall into the category of suspected, either known infected or suspected to be infected. You've got to be very careful to prevent known or suspected infected employees from remaining at work, either at your main location or at remote locations, until they are technically and officially cleared for return to work. um, this might seem self-evident, but even if somebody's sick or infected with COVID, it's perfectly okay for them to work by telework, so long as their illness doesn't expose or provide a potential exposure path to other employees. So you have to discuss all of these issues. That is your processes. If your business is one that has contractors or contract employees on site, you have to discuss issues regarding exclusion of known or suspected infected folks with those subs or temporary work suppliers. And here I'm going to refer to a bunch of details that you really need to sort out for yourself and go through for yourself on a detailed basis. But you have to establish a HIPAA compliant system to receive positive COVID tests from employees and other workers, meaning non-employees. And there are specific requirements about the period within which that receipt needs to occur. 2 days before symptom onset or a positive test until 10 days after the symptom onset or the positive test. And you have to tell your other workers, but still preserve the confidentiality of it, and notify your landlord. And there's also requirements that relate to when you have to advise Virginia OSHA, the Virginia Department of Health and the Virginia Department of Labor and Industry. These requirements are somewhat different from the temporary standard. And so if you have 2 or more cases within a 14-day period, you have to alert the Virginia Department of Health. And if you have 3 or more, you have to also alert the Virginia Department of Labor and Industry. There's reporting deadline requirements. You have to do it promptly. And the employee has to have access to their own exposure and medical records. You have to develop and implement return to work procedures and policies that are in compliance with this. And in summary, they have to be fever-free for over at least 24 hours and their symptoms have been improved at least 10 days since the first symptoms. Now, there's exceptions for severe cases and a little bit different rules apply there. But I would urge you to read very carefully the return to work processes that are at pages 24 through 27 of the standard that we supplied with you, because that sets out exactly the way your return to work processes need to look. No need to reinvent the wheel. Just implement what is set out there. Asymptomatic people, because there will be asymptomatic people that nevertheless test positive for COVID, they return to work at least 10 days. They have to be out at least 10 days since their first positive PCR test. And on the issue of payment, and I alluded to that earlier, the employer has to pay for any return to work tests, but if the employer provided health insurance covers it, then that's acceptable. That satisfies that requirement. There's a number of additional requirements applicable to all employees. So Chris, why don't you take over for those?
All right. Well, one of the next things is I think a question that comes up quite often is okay, if you have an office or you're working in your building or where, do you need to look, I guess, kind of assess where everybody's located, what they're doing, and establish policies and procedures to try and keep people as socially distant as possible, or physically distant as possible on the job. I think what the standard kind of alludes to the fact that preferably, we'd rather not have people just in one common area break room having lunch all together or something like that. If people can eat, say, have lunch or something, or break time at their own desks or their own spaces, that's preferable. However, if you can't do that, to try and reconfigure the areas to establish kind of maybe a schedule for when people can use the break room, so that less people are in there at the same time. And it'll actually list on page 28 of the standard, they go through some requirements as far as setting up, if you have like one of these common area break rooms or something, where you should put kind of signage up at the door saying, I guess could be nothing more than a piece of paper on the door just saying this is kind of the procedures for when the room can be used and for cleaning up and everything like that. Also, if you have employees that ride together that or work, you have to go out to job sites or something, that they all drive a common vehicle, there may be additional requirements for adding masks or additional PPE for them, or trying to come up with alternative solutions to everybody riding in the same vehicle, if that's possible. And kind of along with that, just in general, you should ensure compliance with your employees that they are actually wearing the PPE. I know that's sometimes not always the most comfortable sort of conversation to have with people, and so some people are more in tune to it than others. But I've run into circumstances where clients have had employees going out to job sites or other places, and they get complaints to say, well, somebody came in and didn't wear, they had their mask on or it was falling out their face. You really got to make sure that they that they are doing what they're supposed, that your employees are doing what they're supposed to. As far as following sanitation and disinfecting procedures, some of this, depending on what type of industry you're in, there may be greater industry requirements for how you disinfect things. Obviously, you need to train your employees on making sure that the areas are clean, especially when you're dealing with, not just, obviously a very important one is if you have somewhere, you have a certain circumstance where someone is a suspected infection has been present. And what they say is, if at all possible, if you have an area where somebody has been in that or think was positive at the time, instead of just sending someone in necessarily to immediately sanitize it, which could potentially expose them, if it's possible, to leave that area alone for about 24 hours and then sanitize it to try and reduce transmission to the person actually cleaning. As Mike alluded to earlier, you must clean common areas at least once a shift, or at least once per 12 hours if there are multiple shifts. Obviously, disinfect tools that are implements to things that are shared between employees or clients. And you should only be using approved cleaning and disinfecting products. And you ask, well, what are approved? The standard says anything that is the EPA, and you can go on their website, and it's actually pretty easy to find, but they have EPA list in Nancy is the list of approved disinfectants, and it's hundreds of things. I think a lot of bleach products, things like that would make common sense, but so you want to make sure you use those. You should provide frequent access to your employees or customers for soap and water and hand sanitizer during work. But I think that's really the end of the main, the main requirements. Mike, unless you have anything else to add to that?
No, not on that. Remember, so now what we've just gone through is the requirements applicable to all employers. We're going to move now to subpart 50, talking about requirements for employers that have job tasks with hazards classified as very high or high risk.
Mike?
So, yeah.
May I interrupt with a few questions that have come through to me on the all employees?
Yeah, sure.
Okay. The one was about item number 7 in the summary, which was employers that you can have employees working from home if they have been confirmed sick, or if they were exposed and so they're quarantining. Does that imply that the employee can work at their regular hours, or do you accommodate per employee, or is it up to the business owner to decide?
No, well, I think you would apply your ordinary business practices. If an employee's sick, I mean, if they're sick and they can't perform the work, you wouldn't create new standards for them now just because this standard says if you have COVID and you're at home and you're quarantining, you can telework. All this addresses is the issue of whether or not your work exposes the suspected or confirmed infected person to other people and creates additional potential exposure. The observation I would make is whatever the employer's ordinary practices as to illness would prevail. And to me, that wouldn't change just because now that they have COVID and are teleworking or eligible to telework, if they're so sick they can't concentrate, they shouldn't be working under any circumstance. So anyway, Chris, do you any?
Yeah, no, that was exactly what I was going to say. Is that's kind of along those lines. I think you don't want to be in a situation where you're trying to say, hey, you need to get this work done while the person's laid up in bed. But no, but if you have somebody, I think the idea there is somebody maybe who's asymptomatic or mildly symptomatic and feels perfectly comfortable to be at work, then it's okay to let them work if they want to, as long as it's not going to expose somebody else.
And I obviously, in a law firm like ours, we're in a low risk. We're in the lower risk because it's easy to distance people. It's easy to follow the rules. We don't, a lot of people have been working remotely from home, and sometimes they've been out of the office because of a suspected or known infection. Mercifully, we haven't had anybody that has been, terribly sick with COVID. On the other hand, we've had folks that, even though they were quarantined, they were very anxious to work because they were bored. So that's why I guess I get back to whatever your ordinary policy would be with respect to working when you're sick. But that's a different question than what's addressed in the standard here,
Sure.
Which addresses the question whether or not there's additional potential for them exposing other people.
Thank you. That's helpful. I think it was just some clarification there that was being asked for.
Maybe we said too much, but anyway.
No, and the other was, perhaps this is in the full code, but does a severe case, does that equal hospitalization, or is that again an individual determination?
You're talking about I assume they're referring to the return to work rules.
Yes.
And the standard uses the example of somebody that's very, very sick, and uses the example of somebody that might be terribly immunocompromised in the first instance, so that they are really, really sick with this. And yeah, I think hospitalization would be a good example of that. The really extreme example of that would be somebody that was not only hospitalized but intubated. But then you got to look at different standards for, the return to work, and they're set out, as I mentioned, in pages 24 through 27 of the standard that we provided here. But that's where I would go to check that, and I don't think there's any question that hospitalization is a severe case.
Thank you. Those are the two questions that came up, and we can continue. Appreciate it.
And also, by the way, I received a question that was directed to me by a participant, and that's the kind of thing that I think we would probably need to address afterward. I'm happy to visit it with anybody about a particular question if they need to, but that was one that struck me, because it came directly on my screen. I'd be happy to visit about it later.
You can continue on. Thank you, Mike.
Yeah, I think we were at subsection subpart 50. I'll start subpart 50 by simply saying that, again, this is not an area that has had a lot of change or modification. Broadly, we can see in the definitions that Chris talked about that what we're moving from is it's a continuum of the truly highest and most dangerous exposure and catching the disease risk down to situations that don't put people in a closely personal proximate position so that they're likely to transfer the virus. The high risk, the very high and high risk requirements, I think it's fair to say when we look at, for example, the technical requirements, that is your air handling requirements, where the employer has control over that. You have to maximize the efficiency of your equipment. You need to use all you need to identify and use all the engineering controls that they provide to maximize the effectiveness of your air control. You have to make sure you comply with the uniform statewide building code so that your equipment, in short, is working. You need to make sure that airflow is at the maximum level possible, consistent with the air filtration specifications for your equipment. There are certain circumstances, as I recall in here, where isolation airflow is required. And that, if you're in the healthcare business, if you're a pulmonary specialist and you're doing these procedures that create aerosolization, okay, you're already going to know, and you will already have been practicing a whole lot of this just because it's good medical practice and good self-protection sense for your nurses and technicians and doctors and so forth. But this sets it all down on paper. It requires some things that seem obvious, make sure that the filters are clean and within their working life. Move work within your workplace to cleaner versus potentially less clean zones. I referenced earlier the so-called airborne infection isolation rooms. I know that hospitals have been working on low pressure, creating whole low pressure wards in hospitals, particularly where the COVID patients are housed. Not only do you do it, you have to make sure it works. There's special procedures for special circumstances like medical examiners and that sort of thing. I don't think we have any of those participating here today. You do, in that instance, have to pre-screen your employees, and that's an interesting requirement that isn't necessarily applicable to the other categories. You have to be very careful about limiting non-employees in your facility. You need to post signs concerning basic information about COVID symptoms and ask for symptom reports and so forth, along with, as the standard puts it, enhanced employee monitoring. The standard also requires of these employers with these sorts of risk hazards that they make psychological and behavioral support for stress caused by this, uninterrupted exposure that we presume applies here, to the extent feasible. That has to be provided for free by the employers. Simple things, again, like providing hand sanitizers that are made of a prescribed formula have to be made available. Once again, I suggest that a lot of this stuff is things that people in these categories have already identified and are already doing in their own interest. But it's written down here. So if you're making a plan and you're in that category, again, don't reinvent the wheel, right? Make a list of the stuff they recommend here, then go through the second iteration, determine if it's applicable to you. And then number 3, write down what you did to comply with it. And boy, oh boy, that's giant help if a DOLI inspector comes around your house, thumping their Virginia OSHA inspection list. Clearly, you have to provide the proper personal protective equipment, and you need to do an assessment of it, make sure that it's appropriate. Probably the single significant or very significant item under this, and this isn't new, is the employer must have gone through this process and certify in writing that their workplace hazard assessment has been performed, and the standard provides the contents of the certification. In other words, you can't just write a sentence, "We did it," and sign it and date it. There's contents in the standard that say you got to identify who did it, when it was done, etc. Lastly, if you have folks that that are present there, have exposed them, they have to be provided personal protective equipment as you help them out of the building. So anyway, those are the subpart 50 items. Chris, why don't I turn it over to you for the subpart 60?
All right. Well, subpart 60 is again the requirements for jobs that are in the medium risk category, and a lot of actually what Mike just went through, a lot of those same things apply to the medium risk categories. Obviously, things like requirements like in hospitals, COVID-19 patients should be put in isolation rooms. Obviously, you don't have that if you're in subsection if you're under the medium risk category, but things like monitoring the airflow and filter systems in your and replacing those systems in your buildings, shifting work to cleaner zones, pre-work screening, and providing hand sanitizer, PPE, and adjusting work assignments to telework, adjustable hours, things like that. Those apply as well, and those requirements start on page 42 of the standard, and they're pretty straightforward. Honestly, they're really, it's pretty, like I said, it's a pretty easy thing relatively to read through and just kind of compare. Okay, do these apply to us or not? One thing you see, especially you'll see now, and it's because restaurants and because grocery stores, things like that, you see where feasible, they recommend installing physical barriers to mitigate the spread. So, obviously you go to the grocery store, a lot of times at the checkout, there's a plexiglass thing right there between you and the person checking you out. Those type of things, if where feasible, they are requiring those. Then as far as and again, I guess going back real quick to requiring you to pre-screen employees before they come into work to confirm that they don't have any symptoms or haven't been symptomatic. Again, sort of, you have to perform the same as with the very high risk, perform hazard assessments and select the right personal protective equipment for the actual jobs you have. And as Mike said, same again, you have to certify in writing that the workplace hazard assessment has been performed. So those are largely the requirements. It gets into much more specific detail within the standard on those, but largely I think they are very similar to the very high risk, other than there's certain things in the very high risk that apply to things that are obviously people you're not working on in a lab scenario or with samples and things like that. So they don't go into that detail, but as far as keeping people socially distant, providing barriers, providing PPE, and adjusting your work procedures, and certifying that you have gone through these requirements and what you have done to comply with them, is something to have in writing for, again, if you have a dole inspector come check out your facility.
So we'll turn now to subpart 70, which is the infectious disease preparedness and response plan, which is at pages 47 through 51 of the standard that we've given you, or provided. Just for reference, subpart 50 is at pages 35 through 41. And subpart 60, which Chris just reviewed, is at pages 42 through 46. Now, I did this with my copy, and you might want to do that to make it easy, much easier to reference. I mean, that might sound elementary, but it's amazing how not having to thumb through 12 pages to get to the one you want expedites getting into something like this. Maybe to summarize the difference between the requirements for very high or high risk under subpart 50 and subpart 60, which is for medium risk. The standard speaks under 50 for very high and high risk as it makes the implementation of the engineering controls and the maximization of the equipment obligatory. 60, it's highly recommended. It speaks in terms of feasibility.
Right.
Now, what does that mean in the eyes of an inspector from the Department of Labor and Industry? They're both very high priority. But on that continuum that we were talking about earlier, which is the danger continuum from very high and high risk down to lower risk, it's easy to form a subjective impression in your mind of the mentality of the inspector when they come to your medium risk facility, or they come to your high or very high risk facility, so far as your compliance with making sure that either you have the equipment you need to perform the high risk or very high risk activities you're involved in, or that you are utilizing to the full extent the material, the equipment that's on hand for moving air and making sure air is filtered, which are the principal areas that they're talking about here. But anyway, let's get back to 70. 70 applies to all employers that have positions that trigger the very high and high risk potential exposure, and also medium risk employers with 11 or more employees. Now, don't ask me how they made the cut between medium risk employers with 11 or fewer or less than 11 employees, which is to say 10 or less employees. Perhaps they figured it was just too small an operation and everybody's too close already to require the actual preparation of a written plan. I mean, but who knows? I mean, who can penetrate the bureaucratic mind? But anyway, the issue here really is, okay, you got to prepare this plan. I alluded to it in my preliminary remarks about the areas you need to check up on. For example, make sure that your infectious disease plan conforms with the few changes that I mentioned between the temporary and the permanent standard. The thing that hit me sort of as an attorney on this, though, is the requirement that you have to designate a person. People that are covered by this, employers that are covered by this, have to designate a person within the company to be the responsible person for implementing the plan. And then the standard goes on to identify specific contents, different topics you have to address and apply to your business and come up with solutions for. least recommendations or practices. For example, um, you have to involve your employees in the development and implementation plan. You have to address the risks of the workplace and the job tasks. Well, we've already done that because everybody has to do that, but it has to be written down here. That's why I alluded earlier that, when you go through this, write down this stuff, because then you've got evidence. You've got evidence for the government if they ever come knocking at your door. You got to identify where the potential sources of disease come from, what their individual risk factors may be. You got to document your engineering, administrative, work practice, and PPE controls that that are in your, if you will, in your quiver, in your toolkit to address the risks with. You need to create a contingency plan for outbreaks. All of these items are listed in this particular portion of the standard, and they should be your checklist. Every single one of these individual requirements should be a page with with that at the head of it for your evaluation, because then, it's the third time I've said it at least, don't reinvent the wheel. Then you can demonstrate full compliance with the standard, and demonstrating that you thought about it. Again, whether or not they agree with how you addressed it, it takes you totally out of the willful violation zone. So that's really all I would say on the preparedness and response plan requirement. But as I say, it has to be in writing.
Right. And so I'll move on then to the subsection 80, which is involved with training of your employees.
One clarification before you go, Chris, one clarification.
Sure.
If you have less than 11 employees, no matter your risk level, do you still have to write the plan?
Well, only if you fall into the medium hazard category
or higher.
If you're a very high or high, you have to. The disease preparedness and response plan requirement, the only people it doesn't apply to are, and that's by virtue of who it does apply to, right, are very high, and medium risk employers that have no more than medium risk employment with 11 or more employees. So the only ones that get a pass on this are medium risk with 10 or fewer employees and lower risk.
Thank you.
Because by definition, they're just not required, you see?
Thank you.
So, and now what's a little different in this is that on the training aspect of it, there is no 11 or less distinction with that. It applies to very high, and medium exposure risk positions. And so if you fall into those categories, then you have to, there's certified that, and actually there are a little bit of training requirements for lower level as well, but I'll get to that here in a second. The training, what it has to include, and this is starting on page 52 of the standard, it is a pretty straightforward list. You have to train people on the requirements of the standard, CDC guidelines, the characteristics and methods of transmission of the virus, signs and symptoms of the virus, risk factors for severe cases. You also need to make sure that people understand that not only symptomatic people can spread, but asymptomatic people can spread it as well. Obviously, this makes sense to train people on safe work practices, disinfection procedures, proper PPEs, social distancing, and another thing is about actually choosing the PPE itself. How do you properly wear it? Which to wear, and then then, as Mike will talk about here in a second, there's certain discrimination that's prohibited under the standard. You have to advise your employees on those anti-discrimination provisions. And then in the actual, and if you are required, if you're under those requirements to have a plan, you have to train them on the plan itself, which covers a lot of the things otherwise, but that we've already just discussed, but they have to actually go over the exact plan itself. So if you're in the very high or medium categories, regardless again of employee number, you have to provide a written certification recording exactly what that training occurred. And that you actually have like a certificate that says the name of the employee, signed by the employee, the date of training, the person who conducted the training. And again, there's a little checklist within the standard itself to that effect. Now, if you have basically, if you're in the lower risk level, you still should provide written or oral information to employees based on the hazards and characteristics of the virus itself, to minimize exposure. And the Department of Labor and Industry has an information sheet, or I guess they call it a hazard sheet, I found on their website, and it basically just this quick summary of a lot of those categories as far as how transmission occurs, symptoms, things like that. And you can actually just provide that if you wanted to employees, and that's sufficient. But there's not any like, I guess, written certification procedure. That's just I guess a good practice to have and to go over with any of your clients. There was one little typo on the outline under training, under sentence or paragraph 3. It says employers in the very high and high hazards shall certify employee training with a written certificate. That actually also applies to medium risks as well. So you have to have written certification. But other than that, I think that is pretty much everything on training. Mike, do you have anything to add?
No, other than from a conceptual standpoint, as you can see, the greater the risk, the greater the burden on the employer, the lower the risk of hazards in your business, the proportionally lower the burden on the employer. Lastly, on the discrimination part, this is very simply stated. Employers cannot discharge or discriminate in any way against employees for exercising their rights or raising reasonable concerns about infection control to anyone under the standard or Title 40.1 of the code, which is a health aspect of the Virginia Code. So it's real simple. It's real simple. Even if you were, which I know nobody here is, even if you were inclined to be antagonistic toward employees in this respect, which of course no one is, the fact of the matter is you better be accepting of the fact that there may be the employee who's going to complain. There may be the employee that demands things that come across to you as absurd in the name of avoiding infection and compliance with COVID protocols. People read and see things in different places and get ideas fixed in their head that sometimes just don't make sense. You need to tiptoe around that and don't discriminate, and don't even make them feel bad about it, because the fact of the matter is that the trouble that can be caused through a discrimination complaint is way more disturbing and way more disruptive than the cold glass of water and the biting your tongue that might be required in order to put up with something that strikes you perhaps as maybe unfounded or inappropriate by an individual employee. Simply put, don't discriminate on employees on the basis of issues associated with COVID concerns. You can, however, utilize your ordinary work clothing dress codes as to messages that might be printed on individual or privately owned face masks. People can't use the right to bring their own or use their own face mask in order to bring disruptive messages into the workplace. Can't do that on a mask any more than you could on a t-shirt, for example. Lastly, and this is an interesting, it's interesting to me as an attorney why this needed to be put in here, but they remind us in the standard that employees are still authorized to refuse to work because of a reasonable fear of illness or death. And they direct you to the Virginia Administrative Code that addresses that specific issue. The operative word there, of course, is reasonable fear of illness or death. And everybody here is sophisticated enough to understand how squishy that term is and what's trash to one is treasure to another. So the fact of the matter is that the folks that wrote this standard wanted to make it very clear that they, broadly speaking, recognize COVID to be an issue that could provoke reasonable fears of serious illness or death and might provoke in an employee a refusal to work under the circumstances the employer has provided or enter a place necessary to perform their work that the employer has provided or is essential to doing the employer's work. So it's an issue. This anti-discrimination thing is an issue that I think the government has emphasized in this regulation should be taken extremely seriously and not scoffed at or toyed with at all. Whether you agree with the extent of what the government's requiring of your business or assess the risks differently than an employee, this is an area where the government, I think, the labor and industry inspector is going to, give all benefits of the doubt to the employee. So, lastly, enforcement. Very briefly, because this is a Virginia OSHA standard, it's enforced like any other Virginia OSHA standard. It's enforced by the Department of Labor and Industry inspector. Some of you may have had experience in the past with labor and industry inspectors enforcing OSHA requirements at your business or a job site in the past. Generally speaking, penalties follow along sort of a continuum of either correct problems that they identify for you, but there's no fine. For deficiencies that aren't corrected, there's fines of up to about $13,000 per violation. And for willful violations, if they get the impression that you're just blowing them off and because for whatever reason you're going to do exactly as you please and you don't welcome their intrusion or recommendations, the penalties are about 10 times that can be as much as $127,000 per violation. So when you couple that with that last little tidbit under the anti-discrimination clause, I think everyone understands that apart from just the human aspect of it, of not wanting people to get sick with this thing, at the very least, it's very much in your business's economic interest to make a workable plan and implement it. At our law firm, for whatever it's worth, we've had essentially no questions asked policy. I mean, if somebody was concerned about the way things were being done here, or they didn't like the risks that the office setting presented them, we said, fine, we'll equip you with a computer. Once we are satisfied that your internet capacity will allow you to actually use that equipment, go home and work from home. Now you still have to perform, you still have to do your work, and we'll make curbside pickup available for you for any documents you may need or what have you, so that your time in the office is utterly minimized. But the other side of that has been, for whatever it's worth, I believe a lot of appreciation for that flexibility and unquestioning approach. So one little anecdote from one little law firm's experience with their employees, because we're employers too. I mean, we're close to 100 employees here. So anyway, don't mess with the standard, I guess is the message, because DOLI is going to take it very seriously. And I think that wraps it up. Thank you.
Thank you so much. I know Mike and Chris, I've gotten a number of comments thanking you all for sharing, and that this has been very helpful. And we do have a few questions. We will do our best to finish here by 9:45, as we had said for folks. And I know some people have to leave, so remember that the recording will be available to you. But I had two questions and one that just popped up in the chat. But while I prepare that, Chris, could you go back to the training item number 4 in the summary, which was about the lower risk businesses? Can you restate that one more time for us? I had been asked for clarification on that point.
Sure. Let me pull it up real quick. So, sorry.
Basically, what the clarification was, what is the requirement for low risk on
so
training?
Basically, you to provide, like I say, written or oral information to employees that ultimately may. I think it's just a good idea to provide to all your employees, but employees that may be exposed to the virus, and a lot of it's basically the same sort of requirements as information on the requirements, some of the basic requirements of this standard, the characteristics and methods of transmission, the signs and symptoms of COVID-19 disease, the ability of a person who's either pre-symptomatic or asymptomatic to transmit the virus, and generally safe work practices, that you should be wearing PPE, social distancing, things like that, and along with those kind of anti-discrimination provisions. What they've said is, and I mentioned there on there, and I wish I don't have the link to it right now, but there's the Department of Labor and Industry. I think if you actually Google Department of Labor and Industry COVID information sheet, it will come up in the search. But they have an actual, basically a 2-page sheet that has this information on it, and what the standard says is that you could just provide that to your employees, that sheet, if you wanted, and that would comply with the subsection. So they have Department of Labor and Industry just come up with a summary of what they need, of what is stated in the standard. Said if you give that to your employees, you're good.
That's it. Just for reference purposes, that particular requirement for lower risk employers is at page 55 of the
right,
the actual standard.
Great. And I just put a link to that document you described, Chris, in the chat, and I'll make sure it goes in the follow-up email today. Thank you.
Sure.
Okay. And let me get my notes page here. Now my chat, I have to scroll back up in my chat to find that to find that question. Yes. Okay, here it is. On the certification, Mike, how do you submit your certification?
You don't. You have to prepare it for yourself. You have to
just to have it on
prepare
hand.
a certification.
Okay.
I don't recall seeing anywhere in the standard that requires submission of your certification to anybody at the government. What they're looking for is when DOI comes knocking at your door, they're going to have a list of things they're going to require. Where's your hazard assessment? Where's your certification of compliance? Right?
Okay.
Show them to us right away. First things, I mean, right out of the box, because from the inspector standpoint and from the Labor and Industry Enforcement Bureau or agency standpoint, if you didn't even write it down, then
You're in trouble.
You're going to be a different investigation from their standpoint than one where it's all written down and they can go down your checklist.
Okay. So it's get it done, have it prepared, but we don't have to submit it to someone.
Yeah, unless, I mean, take a look
Unless
in there. I didn't see anywhere that required filing. The only things that require filing are your notifications when they're triggered, as I recall, for more than two or more within a 14-day period to the Department of Health, and the 3 or more during a 14-day period to Labor and Industry. Those are the direct reporting requirements.
Thank you.
So the government's in no position to keep all this stuff straight anyway. How are they going to do that?
Yeah. Good question. But just making sure, someone was just clarifying, do we have to submit it to someone? It's really just,
no, it's a good question. Good question. I'm just thinking about the practicalities of it.
Right.
It's really to be blunt, it's for the convenience of the inspector.
Right. Okay. All right. Well, I know we're about to end. I wanted to bring up really quick for everyone. First of all, thank you again. I know we can't all applaud in person for you guys, but thank you so much, Mike and Chris, for sharing your expertise and knowledge with us today, and for going through this very lengthy document and making it a lot easier to understand. We really appreciate your time and attention.
Yeah, 58 pages is a lot to swallow.
It is.
Bye.
And I will say we have a couple of chamber events coming up, just as a reminder for folks, putting it up here on the screen right now. Our next On Topic event, which is what this is, our new breakfast and lunch series. Since we are not able to meet in person right now, no need to have them called breakfast and lunches. So our On Topic series, we will have our speed networking coming up in March and a business funding panel coming up in April. So keep those in your mind. Our virtual networking is next week at 4 o'clock. This was a lot of fun last month, so I hope you guys will join us. And for our nonprofit members, we do have a nonprofit gathering coming up next week as well. So we welcome your time and attention wherever you can be. And thanks again so much for being here. If you have extra questions, there will be a follow-up email sent out today with documents and links to everything we've discussed, and also contact information for Mike and Chris if you want to follow up.
Thank you, everyone.
Thank you guys so much.
Yeah, bye-bye.